Today I am reading the second last chapter of the Soul of Remedy, the Miasm, book written by Dr.Rajan Shankaran. In a large number of chronic diseases, Hahnemann found that the disease continued to progress in spite of administration of the carefully selected homeopathic remedy. Hahnemann was occupied with finding the solution to this problem, and at length he discovered that chronic disease nearly always had a pattern that could be related to psoriasis, psychosis, and syphilis, the chronic miasm. He postulated that the chronic disease resulted from badly suppressed scabies, gonorrhea, and syphilis, respectively. He then indicated the drug likely to be most useful in treating such cases, the anti-miasmatic drugs. This new understanding enabled Hahnemann to succeed where he had failed in the past. Having studied the theory of miasm and understanding it in the light of my own concept of disease as a delusion, my practice of homeopathy has become much simpler and my prescribing more certain. As I understand it, disease is a false perception of the reality, a delusion. It seems as if this false perception has its root in either an actual situation from the patient's own life or in the situation of parent or ancestor. As long as the situation did exist, the patient reaction was justified. However, the impact of the earlier situation is such that even when faced with another situation, the patient's reaction is as though he even were still in the previous situation. This is his delusion. Relating this idea to the theory of miasm, it became clear that the classification of the disease must be classification of the delusion. And as drugs are nothing but the artificial diseases, the classification is both a disease state and drug state classification. The symptom of the disease represent the survival mechanism called for it in an original situation. But the person feels that in order to survive, he must always respond as if in the original situation. The original situation of the patients means false perception of the reality differ according to miasm of the patient. Therefore, to recognize the miasm, one has to determine how reality is perceived by the patient. The original situation of each remedy would demand an acute psoric, psychotic, or syphilitic reaction predominantly. This miasmatic classification of the disease, based on the concept of disease as a delusion, is not restricted to the mental state alone. We know that the mind and the body work harmoniously as a unit, and the disturbance is uniformly expressed in the both sphere. The state of the mind and body are always related. The delusion belongs to the person as a whole and is reflected at the both level. The mental state, the physical state, and the characteristics feature of the pathology together represent the totality. And before searching for a remedy in the particular case, one must settle upon the miasm first. The miasm of the remedy and the miasm of the disease have to be matched. In order to find out if there was a particular theme of each miasm, I studied some drug generally accepted as belonging to that miasm, attempting to find a common theme amongst them if there was one. I used Hahnemann's classification of disease and the drugs. In acute, there are medicines like aconitum, belladonna, stramonium. Chronic miasms are in chronic psora, syphilis, psychosis. Psora has a sulfur and soranum. Psychosis thuja and madorinum, and syphilis is a mercurius and syphilinum. In studying the miasm with the help of different remedies, I came to understand that the nosor represents the center point of the miasm. The nosor is the product of tissue that is fully under the influence of the infectious disease. It represents these defeated tissues qualities of the infection and infection process. It represents these defeated tissues qualities of the infections and infections process. For example, a study of soranum will show the very character of the sora, likewise madorinum and syphilinum. The problem of the nosor is non-specific and the differentiated character, whereas with other remedies belonging to the same miasm, it becomes differentiated and specific. My conclusion about them sorry my conclusion about theme of the various miasm which follows are a result of a detailed study of the various remedy in relation to the miasm, as well as my own clinical understanding of the drug and the patient. Further, I have added the other miasm that would be lie between the already known miasm listed above. One of these is the tubercular miasm, on which there is abundant literature available. The other additional are my own, having been discovered and verified by me in my practice. Now studying the acute miasm. In the drug of the acute miasm, there is a feeling that there is a strong threat from the outside world. The reaction to this threat is strong instinctively and reflex. For example, Stramonium has a delusion alone in the wilderness. The reaction is seen in the following symptom: the desire for light and company, and children wake up screaming, recognize no one, and cling to those nearby. The central feature of the acute disease itself corresponds to the feeling of threat and the strong, almost immediate reaction. The acute disease has a sudden onset, rapid progress, and the swift termination. It ends either with a death or the recovery. It will be noticed that aconite and the belladonna, which are the best example of the acute miasm, are given in volume 1 and volume 2 of the synthetic repertory under sudden manifestation. And indeed, we do find these drugs a sudden rapid pulse, flush, face, etc. The feature of the acute personality are the patients perceive the situation to the one of the acute threat and therefore react instinctively, sharply and intensely. The situation is overwhelming and there is a state of alarm. The feeling about one's own self are not in the forefront here. Further, the acute personality has a compensated and uncompensated phase. And although these are present in the other miasm as well, they are especially marked in the acute. In general, acute personality are excited, easily excitable, and hyperactive. They react as though to a threat. But when in a chronic situation, these features are heavily compensated for and they become uncompensated only under the stressful condition. This may seem to appear like mood swings, but when we examine closely, they are actually manifestation of the compensated phase going into the uncompensated phase. The dream too are full of compensated phase. The dreams too are full of excitement and represent acute threatening situation. Many of these person could go into the chronic phobic behavior, which means they do exactly the opposite in the life to what they are fearful. For example, Stramonium person may have many pet dog, whereas Stramonium is normally known to have a fear of dog. They can also have a manic reaction like excessive loud laughter and abnormal burst of the courage and cheerfulness. But without the counterpart of the chronic, cheerfulness, there may be also be sudden, impulsive violence as in syphilitic personality. But without the counterpart of the chronic deep-seated pessimism, in general, they functions at a very high voltage. Physical manifestation of the acute miasm are in the form of sudden and violent reaction, exaggeration and threatening condition that cause panic in the mind of the patient and those around him. The state of the mind and body being treated, delusion is expressed at the both level, the mental and the physical. This can be seen in the example of the equilibrium. Acronym has the feeling that something sudden will happen, leading to the death. Mentally, this is a seen as a fear of death, anxiety, and the restlessness. In the physical sphere, we find racing pulse, palpitation, flushing of the face, alternating with the paleness. The acute miasm usually does not cause chronic structural pathology. It can, however, aggravate structural pathology, especially when the tendency means genetic dispositions to such a pathology in quite strong in the patient. The acute miasm will be found more in the babies and children because this is the time when threatening situations from the outside are more often found. The reaction of the acute miasm is innocent, instinctively childlike reaction. Therefore, even when the acute miasm is found in the adult, there is certain childishness and the response. Childishness in the response. Such a response would help one recognize the miasm. This is all about the introduction of the miasm and the acute miasm.